Hey,
I'm like
how's
never
it
done it
going?
live before, so I'm glad I figured it out.
I know it can be a little bit daunting at first. I will
Yeah.
share with you that my first live, I was so excited. I was all ready and so on. And I thought I could do it from my computer. And I know, but like I felt so
Yeah.
foolish. I thought like, oh, it's a bigger screen. It was like I
Yeah.
just felt more comfortable. And apparently you can't.
Yeah.
So
Here we are.
I
Yeah.
really, yeah,
I did
I
it on
did feel
Facebook
really
once,
foolish.
but yeah, adding someone else. So like, are they gonna be able to join?
Yeah, I know. I know. There's always this little sense of like mini anxiety just before because
Never
you
know.
just don't know, right? Yeah. I was on a live earlier today, and I felt so bad for the therapist that I was chatting to because her daughter, a daughter son, I'm not actually sure, had what sounds like a bowel explosion
Oh my
in the.
gosh.
I know. She's like, I actually have to pop off, but she actually had to go, and that's
Yep.
that's
What
fair.
happens
That's life.
happens.
Totally, that's life, and that's I don't know the real world happening around
Right.
us.
Yeah, but thanks so much for joining. I actually just walked home and my package was outside my doorstep. So I literally got it 5 minutes ago. I haven't opened the box, but I do have it.
So good, so good. Well, I'm excited to be here. I'll introduce myself. I'm
Yeah.
Liz. I'm a public health physiotherapist. I'm actually up in Canada, um, and I'm also the public health medical director at Fringe. So I am here, I mean, obviously with you, but I'm here and excited to talk about all things red light for the pelvis, and answer any questions or just chat back and
Yeah.
forth, whatever. Yeah.
Definitely. And yeah, I'm Krista. I'm also a pelvic health physical therapist. And yeah, I reached out to Liz because I've been looking for a pelvic light wand that also included near infrared light. So yours includes both red ear and near infrared light. I've only seen other ones that had red light. So I'm super
Hmm.
interested to hear all about what sets your products apart and all that.
Yeah, and it also has blue light. I'm
Yeah.
using it here. It also has blue light therapy as well, which we can touch on, but just briefly if you'd like
Yeah.
as well, for
Cool.
sure. So what do you want to start by
Yeah,
just
yeah, I
asking
guess just
questions or
if you
yeah,
can give an overview of what exactly light therapy is and how it works. Yeah.
for sure. Yeah. So light therapy in its entirety is basically different wavelengths of light depending on which red or near infrared. There's all different colors of light within the like spectrum, visible and non-visible. So the ones that we're interested in terms of body and healing and sort of tissues is the red and near infrared as well as blue in terms of the light spectrum. So red light we can see with our eyes, whereas near infrared is just a little bit
Right.
sort of higher on the wavelength spectrum there, which is not visible. So our pelvic wand has, and I'll show you here, it has red light and near infrared. So you'll see here the red, and I don't know if it comes across, obviously it's red on my screen, but
Yeah,
some
I
people
can
have
see
said that
it.
it comes across slightly different.
It's right
Okay,
here.
great.
You're
So
glowing red.
yeah, this is the pelvic wand. And so right now there's red and near infrared light being emitted. It's just you can't see the near infrared light.
Right.
The beauty of having near infrared light in our wand is that near infrared light will penetrate your tissues just slightly deeper
Right.
than the red light therapy. And also there's a gentle warmth associated with near infrared. So from a like pelvic tissue standpoint, it's very calming and very relaxing to have a little bit of gentle warmth in the area. So that would be sort of the benefit of having the near infrared light, in addition to all of the like healing properties
Yeah.
of red light. So I can chat to them. Um, I think the main ones for when we're speaking about the pelvis would be that light therapy will increase blood flow to the local tissues. And it does this by like two mechanisms of action that I would sort of differentiate. One is when our cells absorb light, there's a cascade of reactions that occur. And one of the byproducts of this reaction is nitric oxide. And nitric oxide is a very powerful vasodilator. So basically, our blood vessels and tissues will
Yeah.
dilate, like open up, if you will, so that more blood can then travel to that local tissue. And with blood flow, we're going to get increase in oxygen, increase in nutrients, and that could be used for tissue healing. That could be used for an increase in secretions. So if someone has a lot of vaginal
Yeah,
dryness, what you
definitely.
want to do is increase the blood flow to the area so that you have more secretions, more lubrication. And then the second mechanism of action there is angiogenesis, which is the increase in like actual blood vessels and the growth of new vessels or branches to the local tissues. So again, that's increasing blood flow to the
Yeah,
area.
and so many of just the modalities and things we do in therapy are to help increase blood flow and help with healing and muscle tension and all of that
All
as
of it.
well. And you'll see athletes that are having beetroot juice and dark leafy greens to help with the nitric oxide and vasodilate. So it's just, yeah, another mechanism we can use to help increase blood flow and recovery and oxygenation and all of that.
Yeah, so one more sort of modality
Yeah.
just to add to your kit. So I'd say that that's one of the like main benefits of using red and near infrared light therapy in the like vaginal area. I'd say another one is that with light therapy, we have a reduction in the the inflammatory constituents of the area. So if someone's having like a flared or um, like irritated, essentially vaginal zone, that could be postpartum, that could be menopausal, etc. Then light therapy is going to really help reduce that inflammation, which will help reduce pain and irritation in the area. So it'd be like another,
Yeah.
great reason
Yeah, and
to
are there
add
any
light therapy.
other conditions that you see clinically, like maybe endometriosis or painful bladder syndrome, interstitial cystitis, things like that?
All of those.
Yeah, all the above.
All of those. Yeah, of course, totally. And so with some of those, like the endometriosis, for example, that you mentioned, some people might be hesitant to start with like an internal use
Yeah,
of a wand, right? Which, fair enough, I can appreciate that. So what I'll often do with my clients is I'll have them start with an external light therapy wrap, and
yeah,
we have wraps. I brought the
yeah.
wand
And
downstairs
no,
to
with the
show.
near infrared, it's penetrating deep. So, I mean, having it just on the abdomen is probably penetrating deep enough in a
100%
way
is
too. So,
definitely helpful. Yeah. And that's also goes for if you have like scar tissue from even a C-section in like
yeah,
aside from say
yeah,
endometriosis, two separate
yeah,
issues or what have you. But that can be a really nice way to graduate into the use of light therapy for someone with something like
yeah.
endometriosis or PCOS or what
Yeah,
have you, for
yeah,
sure.
I know you guys did a
Um,
lot of testing and making it not seem so crazy to use, and especially people that do have painful penetration, yeah, making your design more easily able to use.
Oh, well,
Yeah,
thanks for sort of noting that.
yeah,
It's true. We consulted with a number of
yeah,
pelvic health therapists in terms of even like the curvature, like just having a slight curvature for like insertion. The actual like diameter is not like I'll say intimidating for most. So it's definitely very like medical friendly in terms of its use.
yeah,
And then it also has four different levels of vibration associated with it. So if someone has a lot of tissue tension, hypertonicity in the muscles, then the wand, in addition to the light therapy aspect,
yeah.
you can use gentle vibration therapy to help relax and sort of
Right. If
calm
yeah, and
some
if
of
you just
that
think of something
tension.
like a massage gun, the vibration really
Yeah.
helps with muscle release, and like it's not meant to be used in a sexual way, but just that
No.
vibration can help the muscles calm down for sure.
That's
Yeah.
exactly. Yeah. So those are some of the reasons that someone might consider using a wand. I'll say another one that I think maybe the most I'll say popular or common reason that I have someone using it in my practice is for tissue integrity. So if someone specifically menopausal has tissue atrophy, muscle atrophy, they might be suffering from some leakage, then I will definitely recommend the wand because of the light therapy aspect. The red and near infrared light therapy helps with collagen and
Yeah.
elastin production and synthesis at a cellular level. And collagen and elastin are what gives us the
Yeah.
integrity
Like
of our
bulk things up a little
tissues.
bit. Yeah.
Yeah, exactly. And so if we have the light therapy helping sort of bulk up, as you said, and add tissue integrity, And then we have vibration therapy. And there, again, there's 4 levels. So if someone has some weakness, then I can ask them to use a higher level of vibration to help connect the brain
Yeah.
with the muscles, right? So often people are just unsure of where, like,
What,
you can't see these
yeah, what to
muscles, they're
engage
inside.
as like a
Yeah.
tactile cue. Or yeah, even in clinic, like sometimes I'll do some light tapping to like,
A
okay, I
little
want
bit
you
of
to engage
tapping.
from more from this quadrant versus another quadrant or that kind of
100%. So
thing.
this is
Yeah.
a way that somebody could then use that same sort of tactile feedback, as you said, that you would use in clinic at home, right?
Yeah.
So the light therapy combined with some of the vibration therapy, combined with the exercise progressions and program that a pelvic health therapist would provide, can be kind of like the golden
Yeah.
ticket where we're using all these different sort of strategies to help someone who has muscle atrophy and potentially prolapse or incontinence or
Yeah.
like leakage, if you will, that kind of thing. So I'd say that that's actually one of the most common ways that I will have somebody um, like oriented to the wand and then essentially purchase the wand for home
Yeah.
use.
And would you say, I don't know how long the wand has been out or how long you've
Mhm.
been able to use it clinically, but would you say for someone maybe that doesn't want to do a topical hormone cream, like topical estrogen cream, have you seen clinically maybe similar results than someone doing a more hormonal topical route?
Yeah, that's a really good question. So I haven't done any study to be able to
Yeah,
compare,
definitely.
the two,
Yeah,
yeah, side by side. So I can't comment on it like a direct comparison. We could look to the research for that, which there is no research to compare the two at this point,
yeah,
right? Because like topical estrogen is what most women will have been prescribed.
right.
But I would definitely recommend using the wand in addition to an estrogen cream. And if someone's can't use the
Yeah,
cream because of different conditions, different reasons, then this is definitely an alternative,
oh,
right? So it can be used in combination or as an alternative.
yeah.
And I have seen great results either way,
Okay,
right? So I can comment on myself. The pelvic wand was launched, like a soft launch, if you will, back in August, and
okay,
then
so
a little bit
super
more of
recent.
a, yeah, it's very recent to the market. Um, and I started using it for myself. I'm 47 and perimenopausal, and I've had 3 children. So like, there's been lots
Yeah.
of different issues in the area over the years. Yeah, um, and I definitely saw results within, I'd say within 2 to 3 weeks,
Okay, yeah,
where I would
super
be able to say,
fast.
like, yeah, and I mean, my issue is more just in terms of muscular strength and
Mhm.
muscle integrity and so
Okay.
on. And so for me, I was thrilled because I have done strengthening exercises. I'm a
Yeah.
pelvic health therapist,
You're
right?
like, I know all
Um,
the things. Yeah.
yeah, I know all the things. I would say that the wand really helped me with compliance. So
Yeah.
I actually did my
Yeah.
exercises.
Like,
This
okay, I
wasn't
have this
something,
10 minutes set aside
yeah,
to just have to focus on this.
something external that I
Yeah.
had to actually sort of set aside the time, not just, oh, I'm in the grocery store lineup
Yeah.
or I'm at a red light in my car. Like
Yeah.
that's valuable, but this did really help me with that. And then I do believe for sure that the light therapy and vibration was what I won't say I needed, what helped me
Yeah.
progress in terms of my
Yeah. Just,
strengthening.
yeah. Make
Mhm.
everything go a little faster.
Totally.
Progress
And
your speed.
I've
Yeah.
had like similar results with my clients. I would say that some people have even expressed like a significant change within 1 week. So I don't see people really, I never see people twice a week. So at
Yeah.
least like I'll see someone maybe once a week or once every two
Yeah.
weeks, etc. Right? And
Yeah.
so I have had with different conditions, different issues, but people come back even within a week and say, this is helping.
Wow. Yeah.
Yeah,
Yeah.
and it's sort of funny because I think sometimes people are a little bit skeptical initially, and they're like, "Oh, come on, really?" But they'll, they'll take my educational piece and they'll
Yeah.
purchase it and so on. But when they come back and they're like, "Liz,
Yeah.
like I'm seeing change,
No, yeah,
right?" And
I'm a
sometimes the
believer.
change
We
is
learned
obvious.
about the light therapy in school, and I think I mentioned that my dad works at the Beckman Laser Institute in Orange County, California. So he works with lasers in work all the time. So he was like, "Yeah, you need one with red light, you need one with near infrared light." So I was like, "Yeah." He was like, "Your parameters are great." So I was super excited to find
Oh,
you guys.
that's actually, you know what?
Yeah.
I
No,
didn't
you didn't
know
know
that.
that. I know
No,
someone else did.
but you had given me such like when we
Yeah.
were emailing back and forth initially, you had such specific questions that some of the questions I even have asked our scientific like head of research. I was like, can you please comment? Like because I thought I knew the answers, but some of them were really,
Yeah.
you know,
Yeah.
yeah,
That's like all
really
he does is work
specific.
with lasers, with more medical, not like client wise like we do, more for research for things, but
Cool. Well, this is the cool thing about what we're seeing now in the marketplace with a lot of red light therapy, whether it be wraps or the wand or all these, like we see head wraps, face masks. Everyone's
yeah.
getting, like, I don't know how
For
many of my
wrinkles.
friends
Yeah, because
ask
I'll have
me,
some people like put
yeah,
their
the
face
fine
mask
lines and
at their
wrinkles.
perineal. Yeah.
100%. Well, the fine lines and wrinkles, it's no different what we're doing to sort of tissue rejuvenation and
Hmm.
regeneration on our face as what I'm, say, mentioning here with the wand for our pelvises, right? Um, but we're seeing this huge influx in the marketplace with red light products because the research is now showing that we can have the same results using LED light as we have used for years, as your dad would know, with lasers.
Hmm.
Right? Yeah.
Yeah.
And so the beauty of using a red light product for home use with LED is that it is safe and effective,
Yeah.
right? Whereas lasers, you need to go to a practitioner, potentially spend quite a bit of money with repeated use or repeated sessions. It's not always convenient. Like there's a whole bunch of sort of barriers
Right.
there that now with home use, a lot of those barriers have been
Yeah,
reduced.
definitely. And what would you say is the best way to kind of incorporate the red light therapy into your daily life? Are you trying to use it every day for a couple weeks, or kind of spreading it out twice a week for
So,
more, longer? Or...
yeah, I think it really does depend on the individual and their condition and how long-standing it is. Like that's like anything, right? When someone asks you, like as a therapist, someone will say like, "Oh, how long until I can, like, I don't know,
Yeah,
get back to
you're like,
soccer or run again or whatever it might be," right? And like not even related to their pelvis, maybe
yeah,
related to like an ankle sprain or a shoulder injury or something like that. And I mean, it's always multifactorial in terms of how someone might progress. I would say for the wand, the recommended use, like just kind of a blanket statement, is using it 3 to 5 times a week. I think you'll see results. That's the recommendation. And that's based on the science, it's based on the research with the amount of light that's being emitted from the wand, the wavelengths of light, the intensity of it, et cetera, et cetera. So it's 10 minutes, 3 to 5 times a week. And then if you're combining it with exercise or with vibration or what have you, we don't recommend increasing that or like doing more than
hmm,
10
yeah,
minutes.
more is
And
not
that's
better.
because of, yeah, it's not with light therapy. And I think that that's a lot of consumers, if you were to compare the amount of light that's emitted from, I don't know, panel A versus panel B, if you're looking at different, I'll say panels or wraps or wands or what have you. Um, and what you really want to look for is that the amount of light and the intensity and the duration and so on is what's backed by research to show a clinical sort of significance and optimal a dosage essentially. And a lot of products aren't, right? So that's why we've specifically said 10 minutes, 3 to 5 times a week, and within like a 24-hour sort of like between dosage or
Mhm.
between sessions. And that's for optimal like reactions that are happening at a
Yeah.
cellular level.
And then maybe once people are starting to notice their symptoms improve, then kind of titrate
Yeah,
up.
of course, of course. So I would say like someone who's wanting to see greater benefit, let's say start with 5 times a week, and then you can reduce it as you feel necessary or that you feel
Yeah.
comfortable. And if someone one other specific sort of thing that I've mentioned to my clients is if someone's suffering from painful intercourse and they have tissue dryness or what have you, I do recommend using the one in this sort of 10 minutes leading up to
Hmm. Yeah.
intimacy. And I think that that makes sense, like from a just
Yeah.
biological perspective, where we want to relax the muscles, we want to increase the blood flow for
Right.
intercourse, right, or
Yeah.
for intimacy in general.
Definitely.
So that would be my recommendation.
Awesome. And would you say there's any change in what your recommendations if someone was to use it postpartum versus menopause, or pretty similar?
No, I'd say pretty similar. I would always recommend for somebody when they're starting out, and sort of contradicts what I just said about 5 times a week, right? But when you're just initially starting with any light therapy, like I would say use a little bit of a moderate approach. where you could say instead of 10 minutes, you could use it for 5 minutes. Just see how your tissues respond. With our wraps, we have a like a 50%, same with the pelvic one, 50% of the light being emitted versus 100%. So you can look at the amount of light and or the duration, and just, I would say, exercise a little bit of caution and just see how your skin responds.
Right.
Some people are just way more sensitive to light than others, right? Yeah.
Definitely. And do you have to be concerned about looking at the wand when it's turned on, or no? Okay.
No, that's like the light waves that are being emitted are not going to be the harmful rays that we're sort of so cautious about when we're out in the sun or
Yeah.
that kind of thing. So no, I mean, that's a really good question,
Yeah.
but no, you don't have to.
Okay.
I don't sit looking right at my
Yeah, yeah.
wand and have it kind of
Like no need to just
sitting
stare at it,
there
but
like glowing. No, definitely, like, yeah, just sort of right in my face. Not at all. But it's completely safe to have
okay.
around for sure. Yeah.
Awesome. Yeah.
I'm
Well,
I'm
yeah.
excited for you to
Yeah,
try
I'm
your
excited.
wand.
Yeah, I have
Yeah.
it right here in the box. I'm gonna open it right when we finish here. So
I
yeah.
would say for clinical application for myself, what I have is I have a wand in my, you can see that I'm at home
Yeah.
today, but I have a wand, yeah, at my clinic. And so what I do is I allow my patients to sort of see it, touch it, see the light being emitted, feel the vibration levels, because some people are a little bit, I'll say, hesitant or cautious
Yeah.
when I say that it has
Yeah, just like a little
vibration.
bit of a buy-in.
Yeah, but then, yeah, exactly. But then they can feel how gentle it is, and see, as you sort of already mentioned, the curvature, the size, that it's not intimidating. And then they can sort of use it, purchase it for home use. I know some therapists will use a medical grade sleeve, like an ultrasound sleeve, just as if you were going for a transvaginal ultrasound
Yeah.
over top of the wand, so that a client can try it in a session. For myself, I think none of my patients have had an issue, like just
Yeah.
seeing it and feeling
Yeah.
it and so on.
Yeah.
And then I explain the utility of it and they purchase it. I really want to spend the time that I
Yeah.
have with my
No, we
clients
don't want to just sit
doing,
there waiting 10 minutes. So yeah.
no,
Yeah.
no, that's not how my
Yeah.
practice is
Same.
run.
Yeah.
So then that's how I've sort of introduced it to my clients in practice. And then I also mentioned that this is just one more, modality that they can use at home to help with whatever their symptoms or conditions are.
Definitely. Yeah.
Hmm.
And if anyone who is tuned in, if you guys have any questions about light therapy, feel free to comment so we can try and get to them as well.
Yeah, if there's any questions for sure. And also, like as we wrap up, if there's any questions that come up even after this, feel free to DM me at Fringe Heels for sure, and I'll be able to get back to you. Or you can email me at liz@fringeheels.com. Or of course, I mean, any questions, feel free to ask. Yeah.
Yeah. Perfect. Yeah. Well, anything else you wanted to make sure we went over?
No, I think I went over, I mean, I
Yeah,
went over
you
the
went
main
through a
things,
lot.
like the real mechanism of action, how we use it in clinic, some of the conditions that I see clinically that it's really useful for. I've sort of mentioned incontinence,